Welcome to the lecture on methodologies for measuring the prevalence of mental disorders. Here's an overview of prevalence of mental health disorders in the US. Obviously, this is across multiple surveys. It's estimated 10 to 30% annually. Adults experience some form of mental illness, depending on how it's defined. The onset is somewhat U-shaped by age, meaning you have more that are very young and very old with a manifestation of this type of illness. Most common adult mental illnesses are anxiety and mood disorders. Mental illness associated obviously with a higher use of alcohol and drugs. It's exacerbating morbidity from chronic physical health conditions, and it's linked to a shorter lifespan. I included in a graph of prevalence of any mental illness among US adults in 2015 according to demographic characteristics. Measuring and counting the prevalence of mental disorders. So what kind of measurement tools are they using? They're using diagnostic classification systems and research instruments. So the classification systems you'd be more familiar with would be like the DSM-5 or the ICD-11. Some of the research instruments include the structural clinical interview for DSM disorders. You also have the composite international diagnostic interview based on the ICD-10 and some validated screening instrument versions for the SCID and the CIDI. Now, scales for use within population surveys. You've got the PHQ, Patient Health Questionnaires 8 and 9, which are good for depression. You have the Kessler-6 for psychological distress, the health-related quality of life for mentally unhealthy days. And then for data reporting formats, you can do incidence, prevalence, or rates. Incidence is the number of new cases in a specific time frame. Prevalence would be the current number of the diagnosis at the time of measurement. And then rates would be the number of cases per a specified amount of population by that time frame. So data sources and collection methods, some advantages and disadvantages. Treatment settings and providers. You can use clinical records, summary reports for government or other organizations, insurance records, and special surveys. Advantages to this is you can get very detailed information. The downside or some of the disadvantages to this is you're having to rely on the accuracy of reporting by clinicians, and also that they are measuring illnesses the same across clinicians. Population or community surveys. These are national interview surveys, surveillance systems, or special focus community studies. One of the great advantages to these is they are far more generalizable to a larger proportion of the population. Some of the downside to this is you may not be able to get as much information. So key sources of mental and substance use disorder for US population data. You've got the Behavioral Risk Factor Surveillance System by the CDC. There's the National Health Interview Survey by the NCHS of the CDC. And you have the National Health and Nutrition Examination Survey and the National Survey on Drug Use and Health. So sources of mental and substance use disorder data from specially focused surveys. You've got the ECA, the Epidemiological Catchment Area Study from 1980 to 85, the National Comorbidity Study, which is a good representative sample of the nation, and then again Kessler in 1994. You've got the collaborative psychiatric epidemiology studies like the National Comorbidity Study. You've got the National Latino and Asian American Study and the National Survey of American Life. Now, the NSDUH, National Survey on Drug Use and Health, I included an image here of one of the initial reportings from its release in 2014. The aim was to provide population statistics on illicit drug use, alcohol use, substance use disorders, and mental health issues. It's representative nationally and in each state by sample weights and multi-stage probability sampling. It's a civilian population, non-institutionalized, age 12 and above. It was a collection of computer-assisted audio, personal or self-administered interviews. Respondents were about 70,000 each year, stratified random selection. The website to check out the data is included. And then there's also the Behavioral Health Barometer for the US and individual state reports. Now, mental and substance disorder state data, so looking at treatment and provider sources. Some of those include the SAMHSA, SAMHSA. They regularly collect data on treatment episodes from states and facilities that provide mental health treatment. Included the website for you to go and check it out. For New York State, you've got patient characteristics surveys, data from assisted outpatient treatment implementation, and some other statistics on the New York State OMH website. County data is more limited and varies by county.